Yes. Hello, everyone. Welcome to the UT Austin Portugal session in Ciência 2020. As any other sessions this year, it's a bit particular. I'm just imagining this auditorium full of people, so I'm also talking to everyone here in the auditorium. I would like to welcome to the session and tell you a bit about how far we have come in this new phase of the program. And actually, we started this new phase 2 years ago. The first year was very, very enthusiastic with many activities on all our instruments, on the way we promote and do activities. And this year, I must confess that we are all quite afraid of how this everything would go, how people would adhere and would get enthusiastic. And at the end, we might have had the most excited year in terms of activities, in terms of participation of the communities, both in UT and also in Portugal. And right now, we are just showing the results of the 2017 exploratory projects. So they are coming to an end, and we are just seeing everything that has been accomplished. We opened 2 calls, a call for strategic projects, so these big projects with 2 PIs each in UT Austin and several others depending on the consortium here in Portugal. All these projects are, let's say, led in terms of innovation by a Portuguese company. We approved 11 projects in a total amount of more than 20 million euros. And from these 11 projects, 10 are led in terms of innovation by SMEs and 1 from a big company. So these are big projects, very hard to put together, but I think the communities in both sides of the pond really managed to do fantastic things. And if this was not enough, we had a call for exploratory projects. So these high-risk, high-impact projects for 1 year. And these have 1 PI in UT, on 1 PI or 2 in Portugal, depending again on the consortium. And we ended up with 8 exploratory projects from a set of very, very interesting and potential applications. So everything is happening. We are just managing the whole situation, but people are really engaged, really doing a lot of activity together. We managed to have, I think, more collaboration between people in UT and Portugal than we had before. So everything is really promising, and we have real reasons to be happy and to be enthusiastic about what will happen next. So without further ado, I would like to pass the floor to Andrea Passos that will carry on the presentations and debate from now on. Thank you very much. Keep safe, okay? Bye-bye.
So, hi everyone, my name is Andrea. I'm the Executive Director of the UT Austin Portugal program. So I'm very pleased to be here today in a completely different environment. We don't have the opportunity to have everyone sitting here today, but technology is helping us to overcome, the problems that were brought about by this virus. So we tried to put together an interesting lineup that will give you an overview of how the program is delivering on its mission. And in our opinion, there's no better way to explain what we have been doing so far than to hear from the voice of the people that have been benefiting directly from the program, and also from people who have been supporting us in implementing these initiatives. So we have a tight schedule, and I'm very pleased to announce our first speaker. She's the principal investigator of one of the projects, an exploratory project that we've been supporting since 2018. For those who are less familiar with this kind of instrument, the ERPs, they're short-term, goal-oriented scientific projects on emerging transformative topics, and they hold promise of evolving into higher technology readiness levels. So in this case in particular, we are bringing the project DREAM, so Drug Delivery Nanosystem for HPV infection therapy, basically a project in the area of nanotechnology that is using the know-how in the nanotechnologies field to develop very high precision treatment regarding cancer. And to walk us through this project, we have today here with us, or not here, but joining us remotely, Carla Cruz. And Carla, she's an assistant researcher in the Health Science Research Center at the University of Beira Interior and invited assistant professor at the Faculty of Health Science. So she has 2 patents granted. She's the principal investigator of 10 research-funded projects, including the UT Austin Portugal program's 2017 ERP DREAM, and she has been collaborating with several international institutions. So thank you very much, Carla, for joining us. And you have 15 minutes to walk us through this project, wonderful project DREAM. Thank you very much.
Okay, and thank you. I will share my presentation. Okay. It's okay? Yeah? So thank you, Andrea, for the nice presentation, and thank you for the opportunity to present the results of Project DREAM, entitled Drug Delivery Nanosystem for Human Papillomavirus Infection Therapy. So the consortium of this project is composed by Centro de Investigação em Ciências da Saúde da Universidade da Beira Interior, that is the leading institution, and several partners. The University of Austin at Texas, namely the College of Natural Science, the Associação Instituto Superior Técnico para a Investigação e Desenvolvimento, namely the Centro de Ciências e Tecnologias Nucleares, C2TN, a Public Hospital, the Centro Hospitalar Universitário Cova da Beira, and the company LabFit Health Products Research and Development. So the idea of the project DREAM, and the acronym DREAM means a lot, arise from the need of the developing of effective treatment for persistent human papillovirus infection. Because the persistent human papillovirus infection leads to cervical cancer. So we need to improve the treatment options for women that is already infected. Usually is asymptomatic, have asymptomatic symptoms, and the vaccination is very effective at the moment, but only for women that is not have been infected by the virus. So the main objectives were synthesize and characterize several nanoparticles that we select. These nanoparticles are based on nucleic acids aptamers, namely G-quadruplex structures, and drugs. After that, we evaluate the nanoparticles in human papillovirus infected cells and cancer cells versus non-malignant cells, and also in human tissues of women infected by the virus. Finally, we select the promised nanoparticles and formulate these nanoparticles a prototype product with a collaboration with the hospital, of course, and the lab fit company. So this formulation is a topical product to be applied in the genital part and for dermal and genital application. So our nanoparticles, all the nanoparticles are composed by nucleic acids aptamers. I show in this picture an example of aptamer, is a IS1411, is a nucleic acid that adopts a specific structure, adopts a G quadruplex structure, and this aptamer have a specific target, that is a protein nucleolin that is overexpressed in cervical cancer cells and also in HPV infect cells. So these aptamer have already reached phase 2 of clinical trials and show several advantages and several disadvantages. So DREAM use not only the IS1411 aptamer for the nanoparticles, but also several derivatives of this aptamer to improve this disadvantage of the IS1411. So just a quick slide. This is a nice picture that we found in Sintra of a similar structure of a G quadruplex. So very nice analogies of G quadruplex. So the first task of our project was a synthesis of nanoparticles. So we select to deliver nanocysts, to deliver drug deliveries. So the gold nanoparticles and nanoaggregates. These nanoaggregates are composed by lipids linked to oligonucleotides. So we link these delivery systems to derivatives of these aptamer, the IS1411 that I show you in the slide, the previous slide. So these derivatives, all of these derivatives form a G quadruplex structure, and the target is the protein nucleon. We test this in the lab. After that, we will encapsulate several drugs. These are antiviral, anti-cancer drugs. These are commercial drugs that are used in the clinic. And also we develop and synthesize a potential drug, a potential compound that is a acridine orange derivative that present anti-cancer and antiviral effects. So this ligand was synthesized by our partner from C2TM. So after that, in task 2, we characterize the nanoparticles by several techniques, namely electronic microscopy and dynamic light scattering to check size and distribution, and other techniques like nuclear magnetic resonance and so on, spectrometry of mass spectrometry, so on. In task 3, we evaluate the nanoparticles that I present. So we evaluate as the antiviral effect of these nanoparticles and the anti-cancer effect. For the antiviral effect, we use human papillovirus cells infected with the 18 and 16 high-risk HPV. We do this in collaboration with the institution from Penn College Medicine from Pennsylvania. And the anti-cancer effect, we check in cervical cancer cell lines, different cervical cancer cell lines versus non-malignant cells. After that, we select the promising nanoparticles that were two nanoparticles, and develop a vaginal gel for topical application in collaboration with LabFit. So the next slides, I will present some results antiviral effect, anti-cancer effect. So in this image, we present some results regarding the antiviral effect. So we grow cells infected with human papillomavirus 18 and 16. And then we incubate our cells with our nanoparticle, and we evaluate several parameters. Namely, we check the inhibition of the growth of the cells. For example, you can see in this image that this cell, the thinning of this cell infected with the human papillovirus 18 decrease. But these nanoparticles don't have effect in human papillovirus 16. Also, we evaluate the genome copies of the virus in the presence of our nanoparticles. You can see that the nanoparticle decrease the number of copies of virus when we increase the concentration of the nanoparticle. Also, we determine the viral titer of after incubation with our nanoparticles. We can see also that the viral titer decrease in the presence of the nanoparticle. So we have effects in the human papillovirus 18 replication, and particular in the viral encapsulation. So the number of virus, the capacity, the ability of the virus to infect the new cells decrease. So this is a nice result we already published. After that, we evaluate the anti-cancer effect also. So we evaluate antiviral effect, anti-cancer effect, because the main objective of DREAM is improved treatment of HPV infection to avoid cancer, cervical cancer. So we also check if our nanoparticles have any effect in cancer cell lines. So we use different cervical cancer cell lines. In this slide, I only present HeLa cells. Is a type of cervical cancer cell lines, and this NHDF is a non-malignant cell line. So you can see that in this graph we have two types of nanoparticles: gold nanoparticles bound to the aptamer and encapsulated drug, the imiquimod, that is anti-cancer drug, and this is a CH, our compound that we synthesize under the DREAM project. So we can see when we increase the concentration also, and in presence of our nanoparticle, the cell viability of the cervical cancer cells decrease, and the viability of the non-malignant cells maintains. So this is a nice result. Also, we can see some selectivity of our nanoparticles to the cancer cells, cervical cancer cells. We also did a lot of experiments, namely uptake cellular, internalization of the cells. These images are from are acquired in confocal microscopy. So you can see this is cervical cancer cells. We can see nanoparticles inside of the cells at green, and also the release of the compound CH. So you can see that our nanoparticle is releasing the cytoplasm of the cells after a few minutes. Also, we determine the uptake by flow cytometry, and also the release of our drugs into the cells are in less than 5 hours. So we also determine the release. Also, I present this microscopy confocal image that show also that this is also cervical cancer cell lines, and I can show you that in this image I can show you that our nanoparticle can recognize nucleolin, that is the target of the aptamer, in cells. So these are, the red is the nucleolin that is overexpressed in the surface of the membrane of the cervical cancer cells, and also recognize the nanoparticle at the surface. So this is a nice result also. That means that our nanoparticle enter into the cells via nucleolin. That is the target of the aptamer, the G quadruplex aptamer. So during these 2 years, we under task 3, we went further. This is another part of the project that we innovate. So after that, we start working with biopsies of human infect with human papillovirus that have precancer lesions. So these biopsies of these women are given by Ipatimub and Centro Hospitalar Universitário Cova da Beira. So we would like to know if our nanoparticles also internalize tissues and how real tissues, real samples, and how it works. So we use SIN1, SIN2, and SIN3 are pre-lesion, are low grade SIN1, and SIN2 and SIN3 are high grade lesions caused by human papillovirus. So are not in cancer yet, but SIN3 progress to cancer if there are no treatment. Usually the treatment is surgery, so we intend to minimize these effects of the surgery. So we use these samples. We evaluate first if the protein is expressed in the tissues of these samples, and we use the confocal microscopy to prove that. So we can show you in this slide that at red, the nucleolin is expressed in these tissues, and also in this another image we show you that our nanoparticle also internalize and the tissues of these samples. So we and also localize nucleolin. So we can also show you that in tissues happens the same that in cells. Okay, that in the cervical cancer cell line. So this is a nice result. Also, we try to check and try to continue to work with these samples to check viability and so on. Finally, under task 3, we select some nanoparticles to formulate as a product, a prototype product, in collaboration with the company LabFit. So we select 2 nanoparticles, and you use the formulation that we use is a common formulation with a common placebo. We incubate our nanoparticle in the formulation, and we use, I present here the results of one system that we test permeation of our nanoparticle in the vaginal tissue with 2 different percentages of propylene glycol, sorry. So we incubate we synthesize two formulations with 2 nanoparticles with different percentages of propylene glycol. So you can see that the 10% of the formulation is the best is a promising prototype, because it retains most of the nanoparticle in the vaginal tissue. So we also perform more experiments, namely viability, release, and so on at the moment. So our project will end tomorrow. I will do some conclusions of the project, but I would like to show you this slide, because these, I think, resume very well the mechanism of the action of our nanoparticles. So we evaluated. First, we synthesize the nanoparticles. We encapsulate the drugs into different delivery systems, and our nanoparticles internalize the cervical cancer cells and the human papillovirus infect cells. So in the two different stages, in the infection and in cancer, via nucleolin protein that is on the surface of the cells. After entering into the cells via nucleolin, our nanoparticles release the antiviral or anti-cancer drug, and we evaluate the effects in terms of decrease of genome copies of the virus, viability of the cancer cells, viral titer. So in two stages, in the infection stage and in cancer stage. So some conclusions. So during the project, we synthesized several nanoparticles and characterize them. So we sell one ligand, one potential drug that is a CH ligand, decrease in the number of human papillovirus 18 genome copies and viral titers. So this is a nice result. Also, we also study the mechanism that affecting the genomic capsidation of the virus. Also, in terms of anti-cancer effect, we have some selectivity to the cancer cells versus non-malignant cells. So we have low cytotoxic to non-malignant cells instead, and high cytotoxic to malignant cells. Also, we went further and used human tissues and also evaluate the nanoparticles in human biopsies of people infected with a human papillovirus in different lesions. And we formulate a nanoparticle as a prototype product to be applied in the for topical application. And we also show that the 10% of this formulation is very promising in terms of results of release of the compound and the permeation of the vaginal tissue after a few hours and stay retained in the vaginal tissue. And this formulation can be explored in the preclinical trial. So for that, we need to continue our research plan because we did all the fundamental research until now. We have a prototype that can continue the study for preclinical trial. So for this, we need to support funding for continue this work. Also, I can show you some outcomes of the project. So we involve a lot of students in this project, a lot of collaborators. We disseminate our results in the international conference, national conference. We have 2 awards also. And we have also published a significant number of papers, and also in collaboration with our partner from UT Austin. So I would like to acknowledge to my team at Centro de Investigação em Ciências da Saúde da Universidade do Interior, to IFCT UT Austin Portugal program for the funding, also another agencies that support us, to my partners, of course, and to other colleagues from another institution, and thank you for your attention.
Thank you so much, Carla, for your very nice presentation. You're no longer dreaming because you brought us very concrete results, so you really need to revise the title of your project. Congratulations. And I'm really sorry because we can't bring up any questions, but I was just told by the organizing team that we really have to move on to the next presentation, okay? Thank you very much.
Thank you for your help, for your support. Thank you.
So I'm really sorry because we're running out of time. And Our next presentation is about another set of activities that we have been implementing since 2018. So it's all about education. And in this particular case, we're bringing to your attention the Advanced Computing Training Program. So this was one of a kind pilot training initiative that allowed several Portuguese researchers to spend some time in Austin in the Texas Advanced Computing Center, which operates, designs and operates some of the world's most powerful computing resources. And I just want to bring to your attention some numbers related to this initiative. So all of the ACTP participants who completed their placement over a year ago said they would recommend this activity. 9 effective placements out of 14 applications were funded by the program. So we had 724 days of immersive hands-on training at UT Austin, in particular at TAC, between 2018 and 2019, and 5 out of 9 participants submitted proposals to further funding schemes. One of these participants has recently been hired to work at the Minho Advanced Computing Center for his experience at TAC. Was very determinant. So just to talk us about this initiative, we have the pleasure to count on the testimonial of Dan Stanzione. He's the Executive Director of the TAC's Advanced Computing Center. He'll be joining us from Austin. And we'll also have here with us João Barbosa. He is a former research associate at TAG, and he had the opportunity to mentor some of the participants that took part in this initiative. So thank you very much, João, and thank you very much, Dan. I'm not sure if you're already connected. Yes, you are. Dan?
I am.
Good morning. Good morning. How are you doing?
Good afternoon. Doing well. Thank you for distracting me on
Thank you very much for accepting our invitation to be here with us today. Okay, so the floor is yours. Thank you.
Well, thank you very much, Andrea, and thanks for the invitation to speak and to tell you a little bit about this program that we think is very exciting. I'm going to go ahead and share the slides here. And it looks like you can see them on the screen there now. Excellent. So, and yes, José will be joining me, who spent many years here in Austin, helping put this program together. And we just want to give you a little bit of background about this in the next little less than 15 minutes, we hope. So, as you all know, advanced computing is one of the 3 focus areas we picked out for this iteration of the UT Austin Portugal project that started just a couple of years ago. And we see advanced computing to be not just about building big computers, although that is certainly something we're very good at and very proud of. And you see a picture of the Nsf Frontera System there. Frontera is the largest academic supercomputer in the world at the moment, and one of the largest machines in the world. For briefly in 2019, for many problems, it was the fastest machine in the world. So, but it's a pretty complicated piece of hardware, and to really do effective science and engineering with this kind of computing, you need to know not only a lot about big computer systems and how they work, but a lot about software, a lot about numerical methods, a lot about applied mathematics, a lot about visualization and how you interpret results through machine learning or through other sorts of analytics techniques to look at the data that comes out of these systems. So there's really a lot of skills that we need people to have, which was sort of the genesis for this program. And advanced computing is used sort of ubiquitously across the sciences at this point. The examples I have on the screen are starting at the bottom: severe storm forecasting, jet engine design, that's actually rocket engine design for the Firefly small satellite launch system, some work from Stephen Hawking a few years ago with colliding black holes on top, and the LIGO instrument looking at gravitational wave detection. But we use this in all sorts of fields of science, in medicine. This year at TAC, obviously our largest focus has been on understanding the mechanisms by which the coronavirus operates and how it spreads, and in designing vaccines around that. It's been about 1/3 of our resources this year has been spent on that. So just to very briefly tell you about TAC, if you don't know about us, the Texas Advanced Computing Center and now our sister facility at the Minho Advanced Computing Center in Portugal, which we hope will follow in our footsteps in many of these things and blaze some new trails. But TAC is about 185 people who work on advanced computing. We have nearly 12 megawatts of computing across multiple buildings and visualization centers. We have the 2 of the 25 largest systems in the world among our about 15 production platforms. We do about 9 billion computing hours per year for many thousands of projects. And we've always been proud members of this collaboration from the very start of it. This collaboration brought me to Portugal the first time in, I believe, 2008, when it was just getting started into Coimbra to teach a summer course. And the collaboration has grown over time, and we work together on systems and software and research work. We have some of the projects that Andrea was talking about are now currently at TAC, looking at sort of big data software stacks with some universities and companies in Portugal. We also send hardware. So this is the former TAC Stampede system, which now is the first machine in Minho, first large-scale computing system, moved from Austin to Portugal about 2 years ago. But what this training program has been about is, now that we have the hardware in place and the research in place, we need to develop people together and try and learn from one another as we move forward. So when the collaboration got started years ago, you know, we would come to Portugal some, and people would come from Portugal to Austin some. And we always found bright and enthusiastic students there to work with. Some of them came to Austin. Zhao was among the first about 10 years ago. And we always did exciting and excellent work together, and felt like we wanted to do more. But so we came up with this concept of a training program. But the kinds of things that we do in an advanced computing center are really varied. And there's a lot of different things that we do, and it can be hard to capture that in something that we can do in a formal curriculum in a classroom. And we wanted to find a better way to sort of train people to do this. And what we decided was that the best way to learn these skills is just to do them. And again, since we'd always found excellent partners in Portugal, we thought the best way to help develop staff for MAC in Minho and for the research computing facilities at other universities around Portugal was just to have the people come and embed with us for a few months. So we created this training program as sort of an extended hands-on experience that has less formal training. There's a little bit of classroom pieces to it, but it's more just getting right to work and getting onto a project with our team and sort of understanding how we can do things together. And everyone from Portugal has pushed us forward. As Andrea mentioned at the beginning, we had a formal application process that happens about once a year. We're a little delayed this year because travel is so complicated, but we had reviewers from UT and from Portugal, and from those we select 3 cohorts per year. We like people to come as sort of part of a small group than on their own, but 3 or 4 at a time. They come to us for about 12 weeks each, so in the fall and the spring and the summer. And it's been a mix of graduate students and postdocs, and even some junior faculty have come for a visit. We've had other senior faculty come visit multiple times. So we've been very excited about what's happening here. And I want to turn it over to Zhao at this point, since he is in the room and can tell you about some of the participants in the process and the projects they have done.
Thank you so much, Dan. So we had a total of 9 people coming into TAC. All of them are either postdocs. Some of them have already finished their PhD. A couple of faculty, I'm remembering Ariel, that is somewhere in there. They were divided into basically 3 groups. One came in the spring, the second one during summer, and then during the fall. The idea was to spread them around as much as possible through the center, since our goal was basically to train these individuals to kind of support MAC as in the excellence centers that probably will come up in the coming weeks. The idea was to spread them around as much as possible through the center so that they can get experience on all the areas that TAC does, from the advanced computing systems, which mainly handles our machines and tuning the hardware and making sure that everything runs, through the HPC that helps users focus and bring applications into the HPC and that they are also tuned and perform well, to the visualization, to life sciences that is dedicated mainly to working with researchers from life sciences, health sciences, and so forth. So the idea was to give them, spread them around so that they all have at least a view of how TAC operates, how they can link into the teams, how we do user support, since our major success comes from tech support, user support. So we focused a lot on those aspects. Sorry, Dan, could you advance? So besides the little bit of formal training that we did, which is basically just teach them how things are run and a little bit of how the application, how we tune up applications and so forth, some basic programming skills that are needed, very light things. They were basically requested to integrate one TAC project, something that we were working on, and bring a project of their own. It's something different if you are forced into a team and you need to gain expertise on the field that that team is working on, and having something that you are a domain expert on and you can actually see exactly what you're doing and understand exactly how you apply the techniques that we typically use on your personal research. It gives you a lot more feedback and it teaches you a lot more than just the training on someone else's project, right? Daniel, do you mind? So besides the project themselves, they were able to do other things, right? For instance, Ana Carolina was one of our interns. We were assembling Frontera, and we had to lay miles and miles of fiber optic cables. She actually was involved in that. She actually went into the data center room and actually performed those steps. She also had the pleasure of teaching one of our courses. We invited her to do that. Since it's part of our user support to teach those courses, we actually invited her and challenged her to do that, and she did. So it's on the bottom. There's a couple of other images. They were able to participate in other activities that we have. We have a huge educational outreach program for high school, middle schools, and so forth, where we bring kids from these schools into the data center and teach them a couple of things about programming, robotics, HPC, and so forth. So they were able to join those. And actually, there's 2 photos using our Stallion display. 2 of the interns that went in actually were in the visualization group. They were trained on how to use these displays and how to assemble them. And at the end, they actually both used it to one of the major things that these display walls are designed for, which is scientific communication. It gives you a lot of pixels, and it allows you to actually show detail. And they love that, so they actually use that. Next slide, please. Yeah, thank you. As Dan mentioned, and so did Andrea, one of our interns is actually now joining TAC. His name is João Diaz. This is a movie from his stay at Austin by the UT program. You can actually go into the website and see it. I'm not going to play it through, but it's on the UT Austin Portugal program. Just go there and see it. It's actually fun. So he's joining TAC, so the cooperation is still going. Most of our projects, most of our interns actually came to us and proposed projects with us to the program itself. There's collaboration going on. There's collaboration going on health data sciences with Kelly Gaither, which is the director of that specific area. There's collaborations going on with the visualization team that I'm aware of. So all the bonds that were created are still there, And the goal that we designed for this training, which was mainly to promote cooperation between the two sides, is actually being fulfilled. And then I'm going to turn it over to you.
Okay, thanks, João, and let the video keep playing. But so obviously this year with the pandemic, we've had to slow down a bit on this activity because even if you could come to the office, you'd be almost by yourself there because we only have a few people in the building since March or so. Most days we only have 10 or 12 people out of our 180 actually at work. But yes, as João here explains, his work from the GRACE satellite, which looks at the gravitational variations due to weight and water in the planet. So, so he did some excellent work, as every member of this training group has done so far. And I think he would tell you we had a great time. And as João Barbosa mentioned, he's joining the staff at MAC, and at least 3 of the others have come back and are working at other Portuguese universities full-time in supporting sort of high-performance computing-related efforts back at their home institutions. So we're very excited about the progress that has been made. I think the rest of this, well, he has to show off the data center, and then he'll show you where he goes to get a beer soon thereafter. And yes, that Stampede's still there in the data center, and the machine that is my background as well. So let me just move to the last slide here and say that though this year has been difficult, we hope certainly by late 2021 or into 2022 to start the collaboration again. And we hope that some of you can come and join us. And since I only have 38 seconds left, I will stop right there and maybe we can squeeze in one short question.
Thanks for the great presentation. The duo was just amazing. But I actually have a question, if the organization allows me to bring it up. So, João, thank you, Dan. I don't know if you're still with us. Maybe?
I am.
Thank you. So, actually, I have a question to João. What piece of advice would you give to someone who was planning to spend some time in Austin, just to make the most of this experience? Because this can be really life-changing experience. And we had João, who was featured in that video. He's now collaborating with Max. So this can be really life-changing. But you have to have a plan, just to make the most of the experience. So what advice would you give to potential participants?
Well, my advice would be, first of all, keep an open mind. What you're going to experience in terms of academics in Austin is going to be completely different from what it is in Portugal, at least for my personal experience. Let's make that caveat. For my personal experience, it's going to be different. They will push you to the limit. And if you are willing to, will break you, build you again, and you will become on the other side better. So that's one of the things. And enjoy the ride. It's a great city. It's an awesome place. People are friendly. Everyone is going to welcome you open-armed. They don't, how can I put this? Let me see if I can find a word. They don't judge you for anything. As long as you are willing to work, you're going to be fine.
So, thank you once again, Dan. Thank you for waking up so early in the morning to join us. See you soon. Okay, so we are now moving on to the next presentation. I'm not sure if Stefan is already online, but very quickly, so we'll be talking about a strategic research project that has been recently funded by the program. So strategic research projects are large-scale, up to 3 years, highly innovative projects led by Portuguese companies. So making sure that research is turned into innovation with social and economic impact, and aiming to lead to new or improved products, services, applications, etc., with international exploitation potential. And we are bringing to your attention today a very interesting project that is shaping the treatment of the future of proton therapy. So basically through breakthroughs in cancer treatment equipment. And the project concerned is TOF-PET. So this is a project in the area of medical physics, which is one of the areas of the program, and it's led by PET-CIS Electronics that aims at developing an improved PET system prototype to be used in proton therapy equipment, better suited for radiation monitoring of head and neck cancers. And to walk us through this project, we have with us Stéphane Tavernier. He's one of the founders of company PET-CIS Electronics, is joining us online. He, in 2010, he retired as a full professor at the University of Brussels to found this company, a very promising company in the area of cancer treatment equipment. So thank you, Stefan, for joining us today. I know that you're not in Portugal. That was one of the reasons why you could not join us here today in person. But thank you anyway for being with us today. Thank you. So you have 15 minutes, okay? I don't know if you can hear us. We cannot hear you.
So yes, I was muted.
You.
Sorry. Now you hear me, I presume. So thank you very much for inviting me here and giving me a chance to talk about this project. So let me share my presentation, which I hope should work fine. So do you see my presentation? I presume you see it. Are you seeing the presentation?
Yes, we can see it.
Okay, very good. So, the name of the project is TOF-PET for proton therapy. And just to situate the context a little bit, so you of course all know that Portugal will have a proton therapy center in Lisbon in a couple of years from now. And there was a call for proposals which aimed at enhancing the scientific and technical knowledge in this area in Portugal, because this is new in Portugal. And so this was basically the aim. So we set up a project which is led by the company, a startup company, PET-CIS Electronics, and that is required by the system. And of course, we have partners in Austin, so the University of Texas at Austin and the MD Anderson Proton Therapy Center there. And in Portugal, we have the pleasure to have 3 excellent academic teams that join us in this project, and they are listed here. So I don't think I need to go through that in any detail. So let me try and explain what is the whole idea and the whole aim of the project. So you certainly know that the most common way to do cancer radiation treatment of cancer is done with gamma rays. Now, gamma rays are sort of X-rays but higher energy, so they have higher penetrating power. And so you irradiate that patient, and you irradiate them from different angles around it, and you have a machine as is here. So this is still a relatively big machine, but still something that fits in a kind of room, and the accelerator generating the gamma beams there on top, but it can rotate around the patient. Now there is another method that can be used and is used, and that is based on, instead of using gamma rays, on using protons. Now, to produce protons, you need a bigger machine because it's harder to produce protons of the energy you need than to produce gamma rays. And there are several ways to do it, but the typical way is a cyclotron, and that's the kind of machine you see here. So there is no person there, but the kind of person standing here, you can see this pretty big machine. It would probably also be a little bit frightening for patient if you would put them in front of this machine. So the patient doesn't see that machine, the patient sees something like this. So this big machine is outside, patient doesn't see it, but you have the beam that arrives there from, and again, this beam can rotate around the patient, and in this way he is treated. Now, the whole reason of all that is the following. In this trivia, you see the effect of sending a beam, either a gamma beam or a proton beam on the human being, on the tissue. So to the left, you see what happens if you send a gamma ray, there is written photon beam, but it's meant gamma rays, on the patient. So a photon beam is like X-rays, so they decay exponentially in the body of the patient. Of course, that would not be very good for treatment because you would irradiate all along that line. And so to put more radiation on the part that you really want to irradiate, you are rotating this gamma beam around the source of gammas around the patient, and always constantly making sure that the beam goes through the area that you want to irradiate. And that is how it works. So you do irradiate effectively the parts that you want to irradiate, but you also irradiate unavoidably quite a lot of tissue around this. You just put more because you orient it to that part. You put more radiation in the part where you really want to have the biggest effect. Now, a proton beam is rather different, and that is shown on the picture below to the right. A proton beam enters the patient, and as it enters the patient, the protons slow down, they lose energy, they slow down, and as they slow down, the radiation damage, the radiation dose they deposit in the patient increases, and it is maximum at the end of the range, and then it drops to 0. So you see already one big difference is there is no irradiation beyond the point that you want to irradiate. And before the point that you want to irradiate, there is less radiation than at the maximum point. That's different from a gamma beam, right? Or there's more radiation beyond of it. So it has obviously a big advantage, but it also has a big drawback that you have a much more complicated and expensive piece of equipment. So it's really important to use proton beam in cases where the cancer you need to irradiate is close to some tissue that you absolutely do not want to irradiate because it's crucial for the being. So experience shows that one needs about one proton beam machine for 10 million people, so it's normal that Portugal would have that equipment, and that is what is going to happen. So to illustrate this principle a bit better, I show here a picture of, this is pictures from a real treatment of a real patient, and that patient had some area in the lungs that there was a cancer that needed to be irradiated, and that was close to the heart, and you can imagine you don't want to irradiate the heart too much. And you see here the difference really illustrated. The top image shows you in color code how much radiation is deposited in a particular part of the tissue. And of course, you put the maximum irradiation in the part that's red there, and that is the part that needed to be irradiated. But you put a lot of irradiation elsewhere around it, and in particular in the heart. If it's used for proton irradiation, then you get the situation as on the lower picture where you have just two beams that concentrate on this point, and indeed you still have some radiation outside the area that you really need to irradiate, but of course it's much, much better than the case of gamma radiation. Now, this works very well, but there is one difficulty. And that difficulty is that you need to be sure of the range of the proton. The direction of the proton, of course, you know that the patient is, you shoot it in the right direction, but how do you know exactly how deep the beam will penetrate before it stops? Because that is crucial. And the way that is done in practice is that one has a CT image of the patient, one make that image, that CT image before the irradiation. And the CT image is basically an X-ray image in 3 dimensions. So you see the tissue of the patient, and you have to estimate the stopping power for protons from the CT image. The problem is that that is not really entirely possible, because stopping gammas or slowing down protons is a different physical process, and you cannot, in a straightforward way, derive the stopping power for protons from the CT image. Essentially, if you know exactly the composition of a tissue, then of course you say, this is the CT image and I have this density of material, I can calculate the stopping power for protons, but I do not know the composition of the tissue with high precision. For example, the tissue can contain more or less water. Now, water shows up very little, has very little stopping power for the X-rays, but is very effective in stopping slowing down the proton beam. So depending if the tissue has more or less water, which you cannot see on the CT image, it will be more effective in stopping or slowing down the proton beam. And you can be wrong on the exact range of this proton beam by as much as 1 centimeter. Now, this is of course pretty bad, because the whole point about proton beam is that you are sure that nothing is irradiated beyond the endpoint of the beam, because you do it when there is some tissue there that you absolutely should not irradiate. But then if you're wrong by 1 centimeter, it's really not good. So how can you solve that? Well, you have somehow to measure the position of the beam during the irradiation. So the patient is brought in position, you shoot a small fraction of the total beam that you want to use, and you try to measure where is the endpoint of that beam and check that it is what you think it should be. Now, there are essentially 2 ways to do that. One way is to use prompt gamma rays. Now, prompt refers to the fact that those gamma rays are emitted immediately. So you have a proton beam, and those protons go in the tissue. They induce some nuclear reactions, not that many, but induce some nuclear reactions. And in those nuclear reactions, sometimes a gamma ray is emitted, just one fairly energetic gamma, typically for MEV, or well, there are several lines in there. And you can observe those gammas, and then you will see essentially where the beam stops. Now, the endpoint of the beam and the endpoint of the emission of gammas is not exactly the same, but you can simulate that, and you can correct for that effect. Another way is to use positron emission tomography. And so because this proton beam also induces nuclear reactions that introduce positron-emitting isotopes. And if a positron-emitting isotopes emit a positron, that meets an electron, and that also gives, in this case, 2 gamma rays that go in exactly opposite direction, and you can observe those, and you do the same thing. You know where the beam is. Now, the isotopes that are most relevant in this and that are produced are, on one hand, carbon-11, which has a 20-minute decay time, and oxygen-15, which has 2-minute decay time. Now, obviously, the most important one is the oxygen. For one thing, you do not want to wait very long after the irradiation to do the measurement, because those things have, of course, you don't want to let the patient there longer. The other thing is that after the irradiation, this is a live tissue. There is blood circulating, and those positron-emitting isotopes may move and may not be anymore at the place where they were produced. So basically, you're looking at the oxygen 15, the positrons that are emitted by the oxygen 15, and they have a decay time of 2 minutes. So in a few minutes, you have the image that you really want. Now, eventually, but that is maybe a very ambitious goal in the long term, eventually it may be possible to, at the same time as you irradiate the patient, if you have injected in a suitable isotope that makes the tumor that you want to irradiate visible, you would have almost the best of all worlds, right? You would see in the same imaging device the tumor you want to irradiate and the position of the beam, and then you would really feel sure that you're doing it right. But I must admit this second is maybe a very ambitious goal. So the problem, though, and why it's not the obvious way to go to use positrons, well, the problem is that you may know that in order to have a decent PET image, you need to surround the patient completely with a PET detector. So you know, all PET detectors are a big ring that surrounds the patient, and you need that ring, otherwise you can't make an image. Now, except that if you have a PET detector where the timing resolution is very good, then you can relax on the condition to have a full ring. Now, the problem is that you have seen the radiation situation with the proton beam. It is not really feasible to put a full ring there because there are all sorts of things there and the beam and so on. So basically putting a full ring there is in practice not doable. But if you could work with a partial ring as shown here, then it could work. A partial ring can work if you have a PET detector that has very good time resolution. Now, it so happens that the company, PETSys Electronics, has exactly that specialty, that we have PET detectors that have really a superior time resolution. And that's why we were approved, because we really had a technology that was crucial to make this approach work. So the whole the activity then in this project that has just started is on the first stage, of course, we have to build the PET detectors and assemble and do that, and that's what we are doing now, and that's basically done with the company PETSys and UT Austin. Of course, there is a very important and very essential part of the work. This is simulation and image reconstruction. And there is Liep Ignas and MD Anderson who are very active on this and will take care of this. And there are biological studies, and that is very similar to the first talk that you have heard, when you can use nanoparticles. And the idea is to look if nanoparticles can be effective in enhancing the radiation therapy effect, so that if you would give the right nanoparticles and bring that in the tumor you want to irradiate, and you need to irradiate, that those nanoparticles to make the treatment more effective. So this is some quite interesting, more fundamental studies that are also part of it. And of course, MD Anderson is involved, but there the beam test will be done. Let me just point out that we will not irradiate patients in this project, because that would not be possible in the time that we have, and that would probably also need more resources. So what we will design the detector, and when we will do studies with phantoms, of course, objects to test, of course, and with animals where we can study the effect of the nanoparticles in living organism and make sure that it produces the desired effect. So what is the outcome that we expect from this project when it will be at the end? Well, there are several. One important outcome is that we will have conclusions on the effectiveness of nanoparticles in enhancing the effectiveness of the radiation therapy. We will certainly have bring more light on the merits of using PET positron emission tomography compared to prompt gammas. Now, I think everybody agrees that PET, if you can really make it work properly, would be superior to prom gammas, but it's certainly more difficult to implement. And so the result of this study could be that, yes, we are able to solve the technical problems, and this is a valid way to approach range verification in proton therapy. And of course, commercial companies involved, because we hope that maybe if all this goes well, that will eventually be turned into a commercial product. Now, let me immediately say that that doesn't necessarily mean that we will be producing a commercial PET system for proton therapy. Also, at a somewhat less ambitious sample in this project, we will develop and improve PET detector models that we have, and we will certainly have a positive result on using those PET detectors in other applications than proton therapy, because PET detectors with a good time resolution are useful in many other applications. So we're really sure that
Stefan,
from the company point of view, this will have some positive.
Stefan, sorry, may I interrupt you?
Sure.
We really need to come to an end. Sorry, I apologize. Can you just really quickly wrap up? Sorry.
It's the end.
Okay, great. I cannot ask you any question because I'm being really asked by the organizing team just to move on to the next presentation. I really apologize, but this looks a very promising project. I have obviously many questions to ask you, but I will have to leave them to another occasion. Thank you very much for your time. So we're now moving on to the next presentation by Tiago Ormigo. Tiago is the co-founder of Spinworkers and is also coordinating another strategic research project in the area of space-Earth interactions. The project concern is Project Upgrade, and it aims at developing the world's first miniaturized space accelerometer dedicated to observing Earth's gravitational field variations. Thank you very much, Tiago, for accepting this invitation, and the floor is yours. Thank you.
Okay, first of all, thank you so much for the invitation. It wasn't something we tend to expect, but it's very nice to be here. Thank you so much. So I'm here to present a project in which we have been involved with the University of Austin, of Texas at Austin. We were actually invited by the team there at the Center for Space Research to developed together with them a new concept that basically follows the kind of technologies that have been already developed at full-scale spacecraft. So just going into the kind of things that we are studying, the entire goal of this project is around the concept of measuring how the gravity is affected over time and in space. And measuring it from orbit. This is not something that's very intuitive. The idea here is that we get a sense of how it varies, not just in space, which is basically what we usually think of when we think of measuring how the gravity is distributed around the Earth, but there's also a time varying component. And this time varying component is not intuitive either. and the idea here is that by measuring a combination of things, we can get into the time varying gravity as well. And the concept that was explored by previous missions, especially the NASA GRACE mission, was that you can actually measure what is going on with your spacecraft in terms of accelerations by using just GNSS data together with the ranging data. And by having accelerometers on board, you can just take out the component that corresponds to the non-gravitational accelerations. And putting it together, this means that you can figure out a number of different components here. So I'll just go into this. Is this working or? No, we don't have a laser. So when you look at the bottom right image over there, which sounds and looks very confusing, the red components you see there are basically the constant components of the gravity, and they are varying in space. So wherever you are, they vary with the latitude and the longitude. And then once you start going into the blue components that you see there, these are relative to the non-gravitational accelerations, which can be measured by accelerometers. And towards the upper of these graphs indicates between 10 to the minus 6 and 10 to the minus 5. That's basically the aerodynamic drag. This is the most important of these non-gravitational accelerations. And then when you go further down into the 10 minus 7 and below, the other blue component you see there is the solar radiation pressure. So the big picture is as you go into further accuracy with the measurements you're taking, you are getting into different components of the gravity. And as you remove them one by one, and this takes a long time, and it takes several measurements over the same place at different times, then you start picking up the less intensive elements there. So our goal here is to go into the orange component you see there between approximately 10 to the minus 8 to the 10 to the minus 10 meters per square second. And that means basically 1/1,000,000th of the intensity of the Earth's gravity acceleration at the Earth's surface. And so this presents a number of difficulties. You can see that the gravity field has these components, which are relative. Basically, they're caused by the distribution of mass on the surface and on the subsurface of the Earth. And this corresponds maybe to oceans, it may be to mountains. There is a specific component you see there in certain areas of the Earth, which corresponds to areas where you have subduction between. So you have the tectonic plates of the Pacific on the right-hand side of the upper figure there with the globe. You can see a subduction area in the Andes region, where there's a lot of the tectonic plates of the Pacific going below the South American plate. And this not just raises the South American plate, but also adds to the mass that is concentrated over there. So there is a number of things that are related to the surface and subsurface. And then there are things that are caused by the lunar and solar gravity. So because they are quite massive bodies. And then you have, besides from this, you have different influences in terms of the liquid components of the Earth's surface and the solid components. So you also need to model all of these. And once you have modeled and withdrawn all of these components, then you get into the interesting part. And that's the concept that we are measuring. We are measuring the motion of the water and the ice on the Earth's surface and near subsurface. And this means that we can basically estimate how the amount of ice changes, as long as it's on a regional scale and in large quantities. We are measuring how it varies over time. And this means things like how much ice we have on top of Greenland, and how much ice we have on Antarctica. And furthermore, and one very interesting thing is that you can actually measure how the water in the subsurface of the Earth is varying. And this typically is seasonal, and you can see it not here, but if you go into the videos describing what the GRACE mission is all about, you can see that there are seasonal changes in the levels of water, of subsurface water, in the Amazon, in the Indian subcontinent, and sometimes when you have regional floods, such as when you have floods over the entire basin of the Mississippi, as you had a few years back. You can actually see that, and you can actually measure it via this model that has been used for NASA GRACE, you can actually measure it in terms of how many millimeters or tens of millimeters of water you have over a regional scale. So the accuracy required for this is immense. 10 to the minus 9 is something that we are trying to attempt to do with the nanosatellite, which is our mission. And it's not something that has been possible before with the kind of or at the size that we are trying to do. So one major thing that will have a huge impact on our spacecraft is that vibrations typically occur. I mean, they might not be large scale. The thing is that if there are even small scale, we are trying to measure things at 10 to the minus 9. And if you have any flexible components on the spacecraft, like solar arrays that are detached from the rest of the spacecraft, or if you have antennas out, then this causes a problem. Furthermore, I just didn't list here, but if you go into the thermal side, you have thermal-induced variations of the structure, and this causes internal stresses, and it causes deformations on the spacecraft, and we need to know them very well in advance. So there are a number of difficulties. These have been dealt by the previous mission that, well, right now there is a follow-up to that mission, which is GRACE-FO, and this is the kind of things that we're trying to deal with at the level of a nanosatellite. So going into the previous mission, so this is really groundbreaking. It followed into the footsteps of the CHAMP mission, but it's really the one that defines how far we can go using this method. So the idea of this mission was to measure the Earth's time-varying gravity. And for that, it used a couple of spacecraft. And you can see there the spacecraft does not have any detached solar arrays. It does not have any detached antenna. It's really, really compact. And it has actually the solar arrays are all around the spacecraft. And it does have a number of instruments. One is a GPS receiver, which is accurate to about 1 centimeter. It has a microwave ranger with an ultra-stable oscillator. And the reason for that is that you need to measure the range between these two spacecraft with exactly the rate that is needed. And if it's delayed by any reason, if we are going into things of the sort of 10 to the minus 9 seconds, any nanosecond difference will make a difference in the overall results for the mission. So you need really to take with an ultra-stable oscillator along. And then you have a high accuracy accelerometer. The changes in the range between the spacecraft are not everything, but they provide a lot of clues as to how the gravity is varying over space. And this is because the two spacecraft are basically following each other with a range of around 200 kilometers. This means around 30 seconds between when one spacecraft goes over a certain place of the Earth's surface and the second. And these two basically suffer the same consequences of the varying gravity. And then when you use the GNSS devices and all the measurements taken by those devices from the different GNSS satellites, you can put all the data together and figure out what is going on. So what are we trying to do? Instead of a large spacecraft, we are trying to, for the moment, to use a single nanosatellite to perform the same kind of mission with miniaturized sensors that we are developing ourselves, with the exception of the GNSS sensor. So there is a huge effort being done right now by the CSR, which is a recurring assessment of how far we can go in terms of the scientific objectives of the mission relative to the technical specifications that we can reach with the technologies that are going into the nanosatellite. Of course, we don't have nearly enough money. When compared to the NASA GRACE mission, we are trying to do things at 1,000th of the cost. But we are using the same principles, and at any given time, we have a good sense of where we are in terms of the goal, the scientific goal of the mission. And this is something that we are working together with the UTA. We have had a couple of meetings already to discuss precisely this, and we are now going into the technical specification part, where we are devising exactly where we want to go. So the idea is to have a science-driven mission, but using as much as we possibly can Portuguese technology. And this is the key thing. So the opportunity was given to us by the international partnerships in 2019 to try and work together with an institution such as UT Austin, but there was also the chance of working with other universities in the US. And we took it to make sure that we could advance as quickly as we possibly could in terms of developing technologies, in terms of preparing ourselves for the international market, which is our main goal, and to try and develop our own technologies such that we could potentially also support other scientific activities as well as commercial activities. So in this case, what we're trying to do is a high accuracy accelerometer, and this is based on INL technology. So this is the Iberian Nanotechnology Laboratory. They have been developing these technologies for about 10 years or even more. We are using our own miniaturized star tracker, which has been developed over time, and you can see an image of that on the top right there. This is an early concept. We have all the algorithms working right now in terms of the image processing. All the structure is right now undergoing already some testing. And we are developing an onboard computer, and this is quite a new effort. Another thing that we're developing, and this is also a key thing for us for the future, is a nanosatellite platform. In this case, is a 6U, a relatively simple one. And this is supposed to be used as a modular platform if we're going into future either products or technologies or scientific experiments based on nanosatellites. This is what we want it to be based on. So we are able to build a platform in Portugal and to equip it with all the devices that are able to make it fly autonomously. And the idea is that we can support not just commercial projects in the future, but also to provide a platform for scientific experiments. And the idea here is that we are doing all of this and we are trying to reach the same kind of goals as the NASA GRACE mission, but at 1,000th of the volume, so that's 1/10 of the dimensions in each direction, and then at 1,000th of the cost. So this NASA GRACE mission was actually not very expensive. It was on the order of 100 million, but we are trying to do it at 1 million. And that's the first unit, because then we're trying to even lower the price in the lower hundreds, if possible, lower hundreds of Ks. And we are trying to do it at such that we can reach the same goals. Even if we have a constellation, it will still be one or even perhaps about 2 orders of magnitude, or as close as possible to 2 orders of magnitude less cost than the NASA GRACE. So how does this all fit into the future? And right now, we have the high accuracy accelerometer. We have a prototype. The same thing for the star tracker. The onboard computer is undergoing development. The platform is now being developed as well. So in the next few months, we'll be able to start showing the results. And this is the main thing that we want to say, is that the results are not going to be seen after 3 years. They're going to be coming out in a few months, and then after that, a few more. So this is the final slide. So this is a strategic project, and not just for UTA. This is a strategic project for us. And the idea that we have, so you can see the camera that we have already developed that's ready and to fly, and we are just waiting for the Infant project to move forward. So the idea is to follow up to multiple other activities that we have done. We are building the capacity to integrate small space vehicles in Portugal in support of not just the technology, but also the scientific community. And besides from this, we are developing a number of different things that are going to support not just this project, but that are going to support the development of many other missions, including potentially the Atlantic Oscillation. That's our main goal. So if you have any questions, I think I'm done with this.
Thank you very much, Tiago. We really have to finish. Okay, thank you. Thank you so much for being here today. And now I'm going to ask colleagues to play the video on the 11 projects that we've been supporting since earlier this year and until 2023. I hope you enjoy it.
Today's world is filled with complex problems, but we are more prepared than ever to navigate them, thanks to science-based knowledge and international collaboration. This is where UT Austin Portugal comes in. Over the next 3 years, the long-standing transatlantic partnership will support a batch of 11 projects with high innovation potential, led by Portuguese companies alongside research institutions and universities in Portugal and the University of Texas at Austin. With a total investment of 21.9 million euros, these projects will help shape a brighter future for both citizens and businesses by developing innovative solutions to real global challenges. Imagine yourself in a few years. Growing old can be a concern for many of us, especially if aging comes along with reduced mobility. Since motor deficiencies are one of the most severe health problems affecting the elderly, NanoStim will develop a garment with an integrated electrostimulation sensor-based system that allows a personalized rehabilitation of muscle injuries and can be controlled at a distance by health professionals. Since health is at the top of our society's priorities, enhancing our understanding of complex biological interactions is critical. By enabling deep tissue penetration with relatively minor phototoxicity, multiphoton microscopy is regarded as an effective tool for long-term observations of live tissue and extraction of large amounts of data. ExtremeMed will deliver a standalone sync RGB film system that reduces sample exposure to interferences and improves photoprotective conditions. Cancer is the leading cause of death worldwide. When identified early, though, cancer is more likely to respond effectively to treatments, resulting in a greater probability of survival. Remote patient monitoring has been applied for vital signs, but Sentinel is looking at it as a tool to remotely monitor patients with high risk of cancer recurrence. How? By developing a minimally invasive and biocompatible injectable biosensor for early tumor surveillance in post-operative prostate cancer patients. When it comes to cancer treatments, proton radiation therapy is one of the most advanced and promising types of radiation treatment. However, measuring the distance protons travel to the tumor cells proves challenging in-bin PET scanning for geometrical reasons, as typically, it takes a ring of detectors surrounding the patient to ensure accurate measurement. TOF-PET for proton therapy aims at building a novel prototype tool featuring excellent position resolution suitable for head and neck, improving the performance of proton therapy equipment with increased accurate radiation. Have you ever felt your car is acting kind of crazy no matter how many times you've taken it to the mechanic? Since cars have become the ultimate electronic device, no wonder that electromagnetic interference is the culprit sometimes. Being graphene the most promising candidate for effective electromagnetic interference shielding, Jammies proposes an advanced technological solution that uses graphene liquid dispersions to protect electronic components, making it highly suited to meet the requirements of demanding vehicle industries. Speaking of demanding vehicle industries, the premature degradation of cutting tool materials is one of the problems that both aerospace and automotive industries face. MC Tool 21 seeks to improve the machinability of alloys through both an optimized coating system and a set of simulation tools that will significantly reduce the wear and tear inflicted by hard-to-machine materials on cutting tools. Existing measure devices for manufacturing processes fail many times to evaluate important process parameters due to issues with sensors placement and their signal acquisition. Thin film technology loaded with sensors applied directly to the equipment looks promising, but installation can be rather tricky. Soft for Sense intends to create a software that will guide the deposition of layer-thin films on top of equipment to avoid mechanical problems during installation. Although water is crucial to our survival, the relationship between human activities and water resources has created a number of threats, harmful to natural ecosystems and human beings themselves. Water pollution is one of those threats, with several health risks being associated with the detection of inorganic contaminants in surface and groundwaters. NanoCatRed relies on groundbreaking nanostructure catalysts to achieve a step change in the performance of catalysts for hydrogenation of inorganic contaminants without generating concentrated secondary waste streams. Oceans are the heart of our planet's weather and climate systems. With climate change emerging as one of the critical issues of our times, Magal Constellation will develop the next generation of radar altimeter instruments to be adapted to a future constellation of small satellites that can understand long-term variability in climate due to changes in sea levels. The rate at which permanent ice loss in polar caps are occurring is also a key parameter that indicates how quickly sea levels will change over the next few decades as a result of global warming. Upgrade aims at developing the world's first nano-satellite dedicated to observing Earth's gravitational field variations and measuring the neutral thermosphere, along the line of past missions such as CHAMP, GRACE, and GOCHI. In the era of big data, computational requirements are significantly substantial, while traditional computing resources are not sufficient to support big data applications, raising technological challenges. High-performance computing infrastructures can find it increasingly difficult to manage resources and ensure fair performance across different workloads. Big HPC will design and implement a novel solution for monitoring and optimally managing the infrastructure, data, and applications of current and next-generation HPC data centers. The future looks bright thanks to projects like the ones supported by UT Austin, Portugal. Altogether, we are creating disruptive science-based knowledge to foster impactful change. Come along with us. Be part of this exciting journey from the lab to the market, from science to innovation.
Muito obrigado ao UT Austin Portugal pela sessão. Nós vamos já continuar a seguir. Às 4 da tarde começamos a sessão plenária, a segunda sessão plenária Ciência em Portugal para uma Europa mais social e digital, que terá 4 intervenções convidadas, a Susana Sargento, o Pedro Ferreira, o Ricardo Paes Mamed e o Rui Oliveira.
So now on stage for the final speech, Professor Mendonça, National Director of the UT Austin Portugal program.
Well, good afternoon. I'm not going to take you more than 2 minutes. The theme of the session was a meeting of minds an ocean apart. That's precisely what we have just got in today's presentations. But it's very unfair to say that it was just a meeting of minds. It was highly qualified, motivated, committed minds working together to foster all the areas of this transatlantic program. Carla Cruz presented as a result of an exploratory project that uses nanotechnologies for cancer treatment. Then Stazione and João Barbosa talked about the training program in advanced computing running at TAC to allow Portugal to have very high qualified human resources and with competencies in HPC of utmost importance to make the most of the supercomputer UT Austin made available to FCT, to the MAC Computer Center. Stéphane Tavernier had an exciting theme, the future of proton therapy in very advanced cancer therapy equipment. This is being investigated in one of the 11 strategic projects. And finally, Tiago Hormigo, co-founder of SpinWorks, brought as the core ideas of a leading project in space-Earth interactions and a fruitful collaboration between Texas and Portugal in the new space area. Special thanks to all the presenters. Finally, we watched the video of company-led strategic projects. I think the video talks by itself. And we actually believe all these projects will support a very close collaboration between Portugal and UT Austin research institutions, enterprises, to foster the transformation of science, to face all the immense challenges we all have in the program for all the areas. Thank you very much and keep safe.